Question I had posed to me the other day is, why are injuries to the same part of the body fatal in some, but survivable in others? If you're new here, I'm Dr. Wolf. I am a forensic pathologist and medical examiner, and I do autopsies to determine how people die. So for those who are in medicine, this is a pretty simple question to answer, but you have to consider that a lot of the people that follow me are not in the medical field, and they have these questions which I think I can earnestly answer. So let me tell you a quick story, a case I had that exemplifies what I'm trying to point out with this question. I have a little skull here, little forced perspective. It looks big here, but it's actually this size. This particular case involves, and this is your content warning, involves violence, self-harm, simulated gunshot that I'm going to talk about, simulated because I'm going to show it on this, but it was a real case. So this case I had, and basically this is a person who had decided to take their life. And so what they did is they put the firearm here underneath the chin and they pulled the trigger. And so what happened is the bullet was angled up, and this rod here kind of represents what happened with that bullet. So what happened was it went through the floor of the mouth and actually fractured the maxilla, came out of the maxilla and fractured the zygomatic bone, but then came out of the soft tissue and continued on. So the key here is that there are no vital structures, okay? It would have hurt bad, it would have maybe bled a lot, but you can survive a wound like that because basically you have injury to the soft tissue of the floor of the mouth, you have bony injury here to the maxilla and to the zygomatic bone, and these can be repaired. And so then, as it turned out, he actually made a phone call after the first shot. And then following that phone call, he decided to change his angle. And what he did is he went here on the side where the temporal bone is. And so when you go through there, you are going to have not a navy blue brain, but you can see this is a little soft kind of mimic of a brain here. And then this is the base of the skull. And so what happens is the bullet's going to traverse this area, which is going to pass through both the right and left cerebral hemispheres. It's going to cause major traumatic injuries to the brain, intracranial hemorrhage, and is essentially non-survivable. So both cases, if they were separate cases, could be signed out as gunshot wound of head. One would be survivable, one not survivable. So in short, it comes down to anatomy. Where did that projectile pass through? What structures did it hit? There are countless examples head to toe where you could have survivability or death.